In this presentation, we will be discussing the anatomy of respiratory system, breathing process, and the disorders of the respiratory system. The respiratory system. Other life processes require a constant supply of energy. Organisms obtain the energy they need by releasing the chemical energy stored in nutrients. The process of doing this is respiration. So what is respiration? Respiration involves a complex series of chemical reactions. There are actually two types of respiration: aerobic respiration and anaerobic respiration. In aerobic respiration, sugar is oxidized or chemically burnt to produce water and carbon dioxide. It requires oxygen from the air or oxygen dissolved in water. Most organisms make use of aerobic respiration to release the energy they need. On the other hand, anaerobic respiration is a type of respiration which does not require oxygen. Anatomy and function of respiratory tracts. Upper respiratory tract is composed of nasal cavity, pharynx, and larynx. The nasal cavity includes the nostril and cavity itself, which contains a lot of hairs or cilia to track any impurities in the air that is taken in. The pharynx is the common chamber between the esophagus and the upper respiratory tract. And the larynx is otherwise known as the voice box. It controls the passage of air, and its contraction prevents food, liquids, and other foreign objects from entering the airway. The lower respiratory tract is composed of trachea, bronchi, bronchioles, and alveoli. Trachea is the one that connects the larynx to the bronchi of the lungs. Bronchi is divided into main stem, lobar, and segmental bronchi. Bronchioles is the transition between bronchi and alveoli. Alveoli is the site of gas exchange in the lungs. Adult lungs contain about 3 million of these. The thorax or the chest is the region of the body between the neck and the abdomen. It is flattened in front and behind but rounded at the sides. The framework of the walls of the thorax, which is referred to as thoracic cage, is formed by vertebral column behind the ribs and intercostal spaces on either side, and the sternum and costal cartilages in front. The following are functions of the thorax: protect the internal organs of respiration, provides the site of attachment for the muscles of respiration, and site of attachment for upper extremity muscles which function during lifting, pulling, or pushing activities. Anatomy of the lungs. The lungs are covered by a thin membrane called the visceral pleura, which passes from each lung at its root to the inner surface of the chest wall, where it is called the parietal pleura. In this manner, two membranous sacs called the pleural cavities are formed, one on each side of thorax, between the lungs and the thoracic walls. The following is the detailed anatomy of the lungs. Right lung are made of three lobes, namely upper, middle, and lower. Left lung are only made of two lobes, upper and lower, plus lingual lobe. Pleura is the thin membrane covering the lungs. There are two of these in the lungs, which is made of the visceral pleura, or the covering of the lungs, and the parietal pleura, which is the covering of the thoracic wall. The breathing process. What is breathing? Respiration involves the blood transfer of gases to tissues and gaseous exchange between blood and tissues. The mechanical process of doing so is called breathing or pulmonary ventilation. Ventilation is the mass exchange of gases to and from the body. The breathing process involves two basic processes: inspiration or inhalation and exhalation or expiration. Inspiration. The diaphragm is the major muscle of inspiration and the primary muscle responsible for movement of air. It increases the capacity of the thoracic cage as it moves caudally as it contracts. The internal intercostals maintain the spaces between the ribs and provide tone between the ribs with changes in intrathoracic pressure. During inspiration, the external intercostals also lift the ribs and increase the dimensions of thoracic activity in anteposterior and transverse directions. Expiration. Expiration is the movement of air from the body tissues via the lungs, then out to the environment. As the thorax enlarges, the pressure inside the lungs becomes lower than the atmospheric pressure, and air rushes into the lungs. The muscle relaxes and the elastic recoil of the lungs pushes the air out, which results in expiration. There can be two types of expiration: relaxed expiration and active expiration. Relaxed expiration is a passive process when a person is at rest. The diaphragm relaxes after a contraction, rises, and the ribs drop. The elastic recoil of tissues decreases in the intrathoracic area and increases pressure, which causes exhalation. In active expiration, it is controlled, forced, and prolonged. Disorders of the respiratory system. Emphysema. This is characterized by the buildup of toxins from cigarette smoke and resulting mucus production that leads to destruction of alveolar and capillary walls and fibrosis of the tissue. This produces large thick-walled chambers, replacing the normal thin-walled alveoli. It results in a larger volume in the lungs, but impaired gas transport and reduced ability to expire the trapped air. Hyaline membrane disease, or HMD, is a syndrome in premature infants caused by developmental insufficiency of surfactant production and structural immaturity in the lungs. It can also result from genetic problem with the production of surfactant-associated proteins. Obstructive breathing disorders. These are disorders that obstructs or delays the movement of air in the respiratory tract. Examples of these are bronchial asthma and hyper or hypoventilation. The Bohr effect. An increase in carbon dioxide in the blood results in a decrease in hemoglobin association with oxygen. This is caused by production of hydrogen produced by the reaction of carbon dioxide and water.